JP Heath with ACT Church of Sweden, and today I'm sitting with Mpho from Inarella. And Mpho, you have significant experience working with children who have been born with HIV. When we think about children born with HIV, immediately our mind goes to pediatric treatment. But there's another aspect that has not been touched. Would you like to share about that for us?
Yes, thank you so much. Usually what's happening is that when a child presents with HIV status, what we look at is putting the child into treatment. And that is not always the case because there are other issues that we can look into, which mental health is also part of it. Children born with HIV are also experiencing mental health challenges or disorder in somehow because of the impact of treatment itself, and also because of the social challenges that they met at home. From the stories we gathered from them is that they didn't know that these are ARVs up until they find by themselves. Others try other methods of researching through internet via Google. Others, they only heard about it when they are in their ages of 12 to 14, where maybe they are sick and they have to go to the clinic. And we realize that parents as well struggle in terms of telling them about their HIV status because parents are not sure at what age is the right time to start speaking about HIV and especially HIV status to them. And these children, they end up finding out about their status by themselves, and that also cause them to at a later stage default, not by choice but by circumstances. Sometimes some of them, they say they default because they are angry. They don't know how did they get infected, and lots of questions that they are having in their mind are not addressed or not even answered.
HIV and disclosure is always going to be a complex issue. Disclosure cannot be demanded of a person living with HIV, and yet if we are able to be open about our HIV status with those who are nearest and dearest to us, we can overcome these stigmas of self-stigma and familial stigma around HIV together. The morality that has been used to judge people on their HIV status has been what keeps people quiet. So if we can overcome these stigmas, we can move to a place where even children who are born with HIV can overcome mental health challenges before they follow them into adulthood.